Thomas. I'm a student nurse here at South. I'm going to be going over all the areas of injection sites. First thing I'm going to be doing is the dorsal area. As you can see, if you lift up their arm, you can see our dorsal insertion point. This top right part right here is saying chromium process, and we're going to be going 3 fingers down from that. So this area right here, normally found in a triangle, is the area where we'll be putting our intermuscular solution in. We can't put a lot in there because it's not a big muscle. And we're going in at a 90-degree angle. The next one we do is our dorsal lateralis. So first we find our insertion point. We'd go our dorsal insertion point, we go 3 fingers down. We go 3 fingers up from our elbow right there. And we come kind of the lateral part right here. This would be a subcutaneous injection site, and we'll be coming in at a 45-degree angle or a 90-degree angle. 90 if they have a lot of subcutaneous tissue or the needle is large. Normally from a 45-degree angle. The next one we have is our forearm. We go 4 fingers from our antecubital, 4 fingers from our wrist. And this area right here is where we'd be injecting. We would be avoiding any large obvious veins in the area. This is an antidermal injection point, so we'd be going in from a 15-degree angle. The next thing we'll do is the abdomen area, which we be this area right here. We want to go above the intercostal space right here or below the cubic space. We would not go past our greater iliac spines right here, and we go 1 to 2 inches away from our umbilical area. So it'd mainly be this U area right here. And this would be a subcutaneous area, so we'll be coming in at a 45-degree angle or a 90-degree angle, again, depending on whether or not how much subcutaneous tissue is in that area. The next area we go is right here, which is the vastus lateralis. We'll be going 1 handbreadth away from the patellar, and we go 1 handbreadth away from the greater trochanter. And it's going to be this area right here. There's normally a intramuscular injection, so we'll be coming from a 90-degree angle, but it can be a subcutaneous area where we'd be coming from 45 to 90-degree angle, depending on whether or not how much subcutaneous tissue is. We won't go beyond the midline of the top of the leg or the midline below the side of the leg. The last one we have is our vastus gluteal area, our ventral gluteal area. So we would put our hand right here on the greater trochanter. We can feel the greater trochanter by them moving their leg, so we can feel it moving underneath my hand. So we'd first put the palm of our hand there. I'd have my thumb pointing towards the pubis. I'd have my index finger along the top of the iliac spine. I'd have my other 3 fingers at the top of the iliac crest. This middle area, triangular area right here, is where I would have an intramuscular injection site. I'd be coming in from a 90-degree angle. I'd also palpate, finding good muscle, and also making sure I'm not injecting into bone. That concludes the injection sites, the normal injection sites that we put on the human body. I'm Luke Thomas, and I thank you.